where we work to alleviate distance. We work to alleviate barriers to distance to education, healthcare, and economic opportunities. And you've chosen a really interesting panel to attend to today, Chicago Leadership and Redesigning Global Health. Today we'll hear from Dr. Melissa Gilliam, a local leader based here in Chicago who is creating a real impact for health of communities, families, and especially youth around the world. What's perhaps the most interesting is the way she's using innovative methods. She's integrating technology with storytelling to create new ways of thinking. This empowers young people to better understand themselves than tell their own stories. With a broad approach combining medical and social issues, her work is creating policy change domestically and internationally. Through the lens of her deeply rooted knowledge of sexual health, our speakers tapping into cutting-edge ways of addressing issues related to race, class, sexual orientation, and these are often marginalized groups, as we all know. Using game-based methods of educating girls on sexual and reproductive health, combined with storytelling to engage young men and boys, our guest is able to transcend sex education from giving information to creating effective understanding that actually shifts behavior. Let me tell you briefly a few of the highlights of her vast achievements. Dr. Gilliam is a professor of obstetrics, gynecology, and pediatrics at the University of Chicago. She's the L&H Block Professor of Health and Justice and Dean for University and Inclusion. She holds a BS from Yale, an MA from Oxford, an MD from Harvard, as well as an MPH from the University of Illinois, Chicago. That's what I said. She's founder and director of CI3. This stands for the Center for Interdisciplinary Inquiry and Innovation in Sexual and Reproductive Health. The CI3 initiative seems to be where Dr. Gilliam weaves together her vast set of skill and experience, where she believes, and I quote, "We can interrupt the cycle of poverty and poor education that perpetuates across generations." Sounds like those working with Dr. Gilliam are shifting their own social norms safely and effectively. After all, CI3's design lab is titled Game Changer, and this has been funded by MacArthur Foundation. Our moderator, Michael Tiboris, is a Chicago Council on Global Affairs' own fellow. He's the Global Cities Fellow, as well as Public Fellow for the American Council of Learned Societies. His research on social justice and public policy has been supported by the Spencer Foundation's Initiative on Philosophy in Educational Policy and Practice, plus San Diego State University's Institute for Ethics and Public Affairs. His work sits square at the intersection of ethics and public policy. Mr. Tiboris he places special emphasis on juvenile justice, education, plus environmental policy. Michael will lead our conversation with Melissa, then conduct our Q&A. Please join me in welcoming our panelist and moderator.
Thank you very much for being here. So before we get into the details of the projects that you're working on, I just want to do some stage setting and talk a little bit about your views about global health and the state of global health particularly. And the subject of this panel is innovation in public health. So we'll talk a little bit about that too. So why do you think, just tell me a little bit more generally about your views about global health and why it's an area that could use innovation.
So just to frame it a little bit, we do projects here in the US, focused on the south side of Chicago, but also work in India at this moment. So I would say, I think there's a little bit of hubris when you say global health is in need of innovation. And so I always want to be careful about that. But what I will say, it's in need of change, right? Both domestically and globally, we have systems of power that say that some people, based on external factors, whether it's their gender or their race or the color of their skin, are less valued than others, and as a result that they have positions that are less powerful. That's my view of the problem, and I think it needs to change. And then I think we're also at this amazing moment in time where we have access to one another, one another's ideas, whether it is through communication or technology, that these problems seem solvable or at least addressable with different technologies or tools that we've brought to them before. So I don't know that there's something that is in need of innovation, but I think there is a particular moment in time, and that the work is really about taking advantage in order to address what I think are really very old and stable and intransigent problems.
So zooming in a little bit on the ways in which those power differentials and social institutions affect people of differential power. How does that affect sexual and reproductive health in particular, and access to those services?
Sure. So the way that we look at it is we put sexual and reproductive health kind of at the center. In some ways, it's one of the reasons that I became an OBGYN. I actually had been a general surgeon, or started a career in general surgery before that, and then I realized reproduction is so core to who we are, sexuality is so core to who we are and our identities, and even if it's a topic that we often do not discuss or that many of us find difficult to discuss, it is fundamentally who we are as human beings. So I think it's just this really critical issue to elevate and to start to address. However, it's really influenced by so many factors outside of what it actually means to reproduce or sexuality. And I think we can even just look at today's political, this particular moment in politics in our recent election, just to see how many factors, how politicized it is. And so I think about sexual and reproductive health within larger systems and structures that also have to be addressed. So the major issues are, if you wanted to look at it from a public health framework, you might say things like high rates of sexually transmitted infections, high rates of pregnancies among adolescents, or pregnancies when women do not desire it, gender-based violence. So there are these very core issues that we can count, but there are also these larger structures that are the things that lead to these disparities in health. And so in our work, we encourage people to think not only about it at an individual level, but what are these larger systems and structures and inequities that actually create inequalities, or what we call health disparities. Some people talk about it as a social determinants, but I think it even goes beyond social factors to really almost structural factors. One way of thinking about it here in Chicago is, I live on the south side of Chicago. It can be really hard to get off the south side of Chicago. Try to find a bus, it's hard to do. But if you think about that as a metaphor for, or literally, access to healthcare, if it's hard to get someplace, if transportation is hard, then that can create an inequity. So really trying to broaden our understanding of what creates inequalities in sexual and reproductive health.
Here's a sort of difficult question, but it's something that I worry about. Well, yeah, I mean, so the embeddedness of those problems in the structure of institutions,
Sure.
does that make them, do you think that makes them easier to deal with or harder to deal with? Does it offer ways to specialists to handle them, or does it make it especially complicated?
Right. So when you first start to think about it this way, when you say, you start to feel like you're kind of unraveling you're pulling a string, and then suddenly everything starts to come apart. It's so complex. In some ways, you say, "Oh my gosh, this is overwhelming. What are we going to do about these? If I just told you it's not just giving someone contraception, it's contraception and schools and transportation and all of those things, right? It does feel daunting and doesn't make it, and in some ways you would say, yeah, it's harder. I actually think it's easier because it gives you more inroads, right? And so it means you don't have to be an OBGYN if you want to work on these issues, right? There's another place that was within your ability. I sometimes call it the piano lesson approach to raising kids, which is, for example, if you keep kids busy, if you keep them empowered and aware of all the things that they can do in life, it actually is a really good solution to keeping them out of risk behaviors. And I think many of us who have young people in our lives, we really do focus on that. We look for their strengths, we look for their abilities, and we really try and support those. My son, it just happens to be piano lessons. However, if you think about youth who are traditionally marginalized, we don't spend as much time thinking about what you can do in life and showing them their abilities and really focusing on honing those skills. We have this collective anxiety about whether they get pregnant, whether they get a sexually transmitted infection. And so this idea of really trying to think about building the assets and strengths in all young people, regardless of who they are, that, I think, is the inroads. And it's not just because I say so. There's actually a body of research that really shows it, that if we can support young people in their education, in their home lives, and in their community lives, or, right, is great, but or is also good. So say my school is really problematic, but I have a really rich home life, that buffers me against the problems and the deficits in this other framework. And so it's really, I think we have many more levers and many more tools in which we can really build the health of young people. And the beauty of this approach is that it also has shown to move a host of risk behaviors. So you don't have to just focus on sexual and reproductive health. Kids who are empowered and supported, they do better in their sexual and reproductive health. They do better around alcohol, drinking, mental health, a host of risk behaviors.
So I think this is a great way to transition into some of the specific things that CI3 is doing. So there's a lot going on there. So I'll start somewhere and we can work to all the details. You have an initiative there called the Game Changer Chicago Design Lab, which uses storytelling, video, and board games as an intervention mechanism, a tool for exploring health and social issues. Can you tell us a little bit more about why something like a board game, for example, would be useful as a public health intervention?
Sure. So I think you can think about this in multiple ways. And I think that's one of the reasons I really like using design and art and creativity as an antidote to, or a way of addressing all of these larger problems, because it is nonlinear, right? There's so many different ways that we're discovering that just play and creativity and imagination can create a place and a way for people to interact and to collaborate. But I'll tell you at least some of the things that we're finding in our research and that we're trying to address. So in Game Changer, that's one of our oldest labs. We're only a 4-year-old organization, so by old I mean 3 years old. But we've been designing games and using the medium of play to address issues of youth development and sexual and reproductive health. So board games. Board games are amazing in many ways. And how many people play board games? Okay, right? So you're sold, right? What happens when you play a board game? You collaborate, you sit around, you break barriers, you talk about other things. Board games have been a through line in my own family with my kids, because it's sort of that moment when we can all do something together, so they really translate well. We also design video games, but technology sometimes scares some people, so board games are also really accessible. But they also help people look at systems. And so the board game that we've been working on the most is a game called Hexachicago. It represents the city of Chicago with a hexagon overlay. You kind of see the lake and the different neighborhoods. And then we invite young people to design Hexachicago games with us and also play Hexachicago games with us. So board design is a great way of having people start to think about and research a topic with the idea, I'm designing something for my friends or my colleagues to play. And so we have young people who get really deeply into issues of reproductive health and energy and smoking because they're designing a game. And they will go to the library and they will get deeply engaged in these topics because they're designing a game. but it also teaches us how other people see these issues. And so we have a summer program called the Chicago Health Academy. And so we take our tools and we keep recycling it. So we have a whole academy around Chicago. But in it, young people work for 3 weeks designing games around topics. They also meet with a variety of health professionals around the campus, and they really learn about different topics. But what we're also doing is teaching people to think critically, to work as teams, to collaborate. These are a set of 21st century skills that people like the National Academy of Science have said these are critical if people are going to be involved in the future economy. We're also teaching them about health issues, but instead of using a shame and blame approach, it's really about you are an agent. You can start to think about these issues, own them, and think about your place in solving and addressing these issues. So it's just a very different way of, instead of what I learned in medical school, which is don't do this, use a condom, or else something bad will happen to you. This way they're engaged deeply in the issue. The other nice thing about board games is they give you a sense of the structure or the systems. So one of the things that we show young people is how the city of Chicago works. I don't know that we can completely make it transparent, but the idea is that there are systems, right? There's systems and structure. So typically when we talk about a health issue, we pose it as an individual problem. You did not do this, therefore you got pregnant. You did not, there's a movement called reproductive life planning. You did not plan your reproductive life. You did not use contraception, therefore you had an unintended pregnancy, and that's a problem. However, if you start to look at the larger systems and structures, so one game we have, it looks at the spread of sexually transmitted infections, and what you can do is decide where health clinics are located. And then you start to notice, wow, how many health clinics are located in my area, and how is the transportation? And then you start to realize this is a structural issue, and it's not just an individual level issue. I'll tell you one more board game, and then we can move on. So the game we're studying right now is a game called Smokestacks, and it's about the issue of tobacco. And Dana Susskind earlier mentioned kind of the gains that we've had in tobacco. And that was through one of the biggest gains was addressing it through tobacco-free youth, or the truth. And so we took that idea of how companies market to young people, and really how that creates kind of a dissonance. And so we have a game called Smokestacks, and you play from the perspective of a tobacco company. And your job is you can choose your advertising campaign, you can choose your product, you're gonna have tobacco, or you're gonna have hookah, or whatever your product is, and then also your marketing strategy and your branding strategy. And your goal is to get as many people addicted to your product as you possibly can, and the more people you get addicted, the more money you get, until you roll the morbidity and mortality die. Right? And that's where suddenly you start to lose all the people you got addicted. And it's really funny. You see people start to kind of say, oh, I just need to get more people addicted. That's how I'm going to win the game. But then the Surgeon General's warnings, and we have kind of an app, and you can look at the different Surgeon General's warnings, and then you start to have new constraints. Oh, now no longer can you use billboards. And so that's how the game progresses. And then we watch as young people have kind of the realization that they're not actually the powerful company. They're more likely to be the pawn on the board, right? So again, trying to teach health issues, but not through hitting them over the head about all the bad things that they have done or the harm that can happen.
So on the research side, one of the things that's unique about CI3 is its interdisciplinarity. And you have people, you're drawing on resources from social science, economics, neuroscience, psychiatry, education. Why take this broader intellectual approach to the research, and what sorts of benefits do you think it's produced in terms of research?
So in many ways, it sort of feels intuitive for me as someone who comes from a medical background. Say you come to a hospital with a problem, you don't say, okay, the only doctor I'm going to see today is a gynecologist. It doesn't matter that I have heart disease, right? Whatever it is you need that day, we bring whatever specialists you need, whatever physical therapist, nutritionist, whatever that patient needs, and we form teams. If you actually mathematically looked at it, you'd have a completely unique team every single time. You probably never have the same medical student, resident, healthcare nutritionist at the bedside at any given time. So why don't we address social problems that way? Bring the most skilled person from the discipline that has the knowledge that is needed in that moment to solve that problem. So that's the philosophy. Now, it's hard, right? Because in medicine, we're all trained. We all go through medical school. We go and we rotate through each other's practices. So at least we have a sufficient working knowledge so that when we go forward, you may be in the emergency room, I may be in labor and delivery, but I can hold a conversation so that we can effectively transfer that patient. That's harder when we start to talk about economics and humanities. My main colleague for game design is from the English department, right? So I'm regularly collaborating with someone from the English department. The work in India is being done with someone in the Harris School of Policy with an economics background, so regularly communicating with economists. So it's harder, and so we actually have to spend a lot of time explaining ourselves to one another, creating a common language. But the philosophy is there, and I think and I will tell you it actually works. So for example, right now in India, we just got back a few days ago, we were just having this conversation about the evaluation of health and the evaluation of education, and also this idea of how what I think about as a social justice issue, an economist might think about a power issue that has to do with money. But when you think about it, when I say gender-based violence, I think that's a social issue. And she's like, well, think about it. What would it be like if you had a person who was subordinate to you? You could go to work every day, and this person essentially did anything you wanted, would act almost enslaved to you. That increases your productivity. So a totally different lens for thinking about it. But again, it deepens your thinking. It might give you new inroads for thinking about it. So for us, part of what we need to do is have a lot of thinking room so we can explore one another's disciplines and think about how we can really deepen what we're doing. And in many ways, I think it also sustains the work because you start to find new ways and new roads and new avenues to start to address problems that in many ways you sort of felt like there wasn't much of a way forward given the way that you had previously addressed it.
So I like the model of thinking about public health not as something that's separate from questions of social justice, that the two are sort of fundamentally connected, that you don't have problems of public health, and then there are justice problems independently, but that they're fundamentally tied up together. So on that note, could you tell us a little bit about you work mainly with communities, entirely with communities that are underserved and disadvantaged. Can you tell us a little bit about the specific sorts of disadvantages that they're facing with respect to access to sexual and reproductive health, and why traditional methods of getting those things to them are not working?
So sort of to talk about it kind of at a philosophical level and then at kind of a practical level. So I think as a philosophical level, one of the things that happens is when you're trained in public health, you use statistics and numbers and prevalence to really describe how bad things are. And that becomes a call to action. The challenge with that approach is that implicit in that is that what they are doing is problematic and what you are doing is not, and you have the tools and resources and ideas to solve problems for somebody else. I grew up in Washington, D.C., but had a family that lived on the South. It lived in the South, and so kind of my parents were part of the Great Migration northward, but a lot of my family stayed in the South. And so I would often travel to visit that family. And in many ways, you would say that is the family that we are talking about when we talk about poor and disadvantaged. But not so much so, right? When I know that family, it is an incredibly rich and vibrant community, and it's not until it really got to my adult years that I realized, oh, that's kind of what they were talking about. So the deficit model is problematic in many ways. It involves not really recognizing the full humanity and potential of other people, and in many ways it's important. It is how, defining something as a problem helps you start to solve it. But I think we have to also just recognize the limitations of addressing problems by saying, oh, it is an internal deficit to that community or you're disadvantaged. I think what we have to remember is that we often disadvantage other people, right? The advantages I have can be at the expense of other people. And so that is a different way of thinking, but it makes you start to kind of question your own work and your own and the privilege that you have. And so because that sort of philosophy is so important, in some ways, the way that we've decided to work is not to think about it as necessarily a public health problem, but to say, in communities, there is so much potential, and so much potential that is not tapped because of whatever factor you want to call it. How do we start to work and engage with communities to start to identify things that they identify as issues that they would like to solve? And are there tools and resources that we might have in order to help them do that? So, for example, one thing that we are addressing right now, this is in Chicago, is thinking about how, if we have such high rates of pregnancy and sexually transmitted infections in some communities, and when the CDC does hotspots, you'll see kind of Illinois looks very similar to sort of the southern United States, and a lot of that has to do with the city of Chicago and urban areas. And so we right now have a Comer pediatric mobile unit that's going to schools and providing health care. And they were trying to keep kids in school physicals, giving asthma medication. And we said, well, why not give reproductive health care? Because if you think about it, if someone has to come to a doctor's office, that's time that they have to take away from work. It's often time that a parent has to take away. And what's the potential consequence to missing school? And so if you have a mobile health unit, why not design a system so that you can actually give reproductive health care? And the way we do it is actually to involve young people in designing the system of reproductive health care. And so, for example, we were sitting in one workshop, and one of the young men said to me, well, what about when it comes to my neighborhood? And I was like, well, it actually goes to the school. Like, it goes to 10 schools, and so, it'll be when you're at school. He's like, well, I'm not always at school. What about the summer? And I was like, oh, yeah, that's a really good point, right? So if I take my kind of idea, right, versus his idea, and then it became really a challenge, right? Because, for example, some medications are every 3 months. Then it's like, well, right, what if we start it when you're in school and then we get 3 months? So really this idea of designing with communities and really just saying that, like, all of the different ideas and being really generative about thinking about what are the solutions that could solve problems that you identify in your life, that's been the approach that we've taken.
So there's using narrative as a crucial intervention tool. Focusing on communities, these are all very sort of local interactions with the health system. Is that something we should be pursuing generally? That should the focus be on local communities and trying to bring about change at that level? What, if any, responsibility do traditional government mechanisms have for encouraging greater access to reproductive and sexual health? Can you speak a little bit about that?
Yeah. So if I'm tracking, okay. Let me see.
Sorry.
Okay. So I think that so the way that we actually think about it is we start local, and then we think about where are kind of more universal applications of the things that we're finding in local settings. So So I'll just tell you a little bit about how why storytelling and narrative has become so important to the work that we're doing. And it's work that we started on the south side of Chicago. We're now doing a number of narrative-based storytelling projects in India as a way of making inroads and insights into reproductive health. So one of our research assistants had come, and she was just describing this great storytelling workshop that she had seen in Brazil. And it had been a time when we were doing a bunch of work around the role of digital media and technology and its implications for sexual and reproductive health. And this work was really important because it wasn't local, right? That we could take something local and then really think about how we could scale it, just because At this point, it is reasonable to assume that if someone does not have a mobile phone or a smartphone now, they will have one in the next 5 years. And so that gives us a tremendous potential to work at very large scale. So that was the thinking. So we decided I was like, you think storytelling is important? Show me storytelling. And so we held a workshop that one I think had between 10 and 14 young people. And it was a workshop around something called digital storytelling. So it's not just telling a story, it's creating a safe space. Usually these last from anywhere from, we've done them as short as 1 day, but we typically work from 3 to 5 days, where we start to use games and a lot of story-based practices to start to have people talk about really major episodes in their own life. Something about this way of coming into a circle, to telling stories, people begin to start to talk about things that often they've not been able to talk about in other spaces. And then we take those stories and we start to craft them into short, almost documentary style videos. They can be actual photos from people's lives. They can be photos that people have taken. And then we have young people sit in front of computers. We have them record sound and narration. And at the end, you get almost these short 2 to 3 minute moments and sketches of people's lives. The ones that we have right now are on our website. It's called Southside Stories, and you can see stories from young people on the South Side. And then one of our colleagues who was in CI3 for many, many years just created an organization called Storyographers, and so you can also see work from storyographers. Stories do a lot of things for us. For me, on the day that I walked into the workshop, I started hearing from young people the things that were really driving some of their behaviors. A lot of them had to do with parental loss, parental betrayal, deaths in their families. And in many ways, I think some of the things that I thought that I was getting at very quickly in a clinical setting were actually just the tip of the iceberg, and really these stories that people had behind them were probably the drivers. The other thing that you see when you tell stories is how beautiful stories are and how beautiful storytellers are. And for the storyteller themselves to take something that was really heavy in their hearts and then externalize it, and to be able to look at it and then to share it with another person and interpret it, I think that's actually goes very deeply into the therapeutic tradition. And then the other potential is it begins to create a conversation for other people. And so many times there are issues. If I tell you a statistic, I will put you to sleep. Or you will say, what does that big number mean? I can't even relate to it. But if you tell a story, it's somebody else's lived reality. You can't deny it. Even if you don't agree, even if it hasn't happened to you, it is someone's story. And you have to begin to say, I'm going to listen to that. So through stories, we're starting to be able to address topics also that are somewhat taboo. Right now, our team is out in India collecting stories and telling stories with youth living in slums in Lucknow, which is a town in the city in Uttar Pradesh. And the way that we work is we work with other organizations. So we actually train them to tell stories. We train their facilitators in our methodology. Often they already have great and deep traditions, and so they're training us in their methodologies. And so then we teach them, and then they help to gather young people who again, create these stories. And so I'll just give you an example. Issues around gender are very deeply rooted in the communities that we are. One young man, and so we really believe very strongly in bringing young men and young women into our work around gender. So one young man talked about his own experience as always actually playing with his sister growing up and playing with his sister's friends, and it wasn't until he got to school and got horrendously teased that he suddenly realized that his way of expressing his gender was problematic for that society. And so it wasn't until this moment of storytelling that he was actually even able to address this. And his best friend kind of said, I've known you for so long, and I never knew that this had been an issue for you. So this is a taboo and difficult topic for these communities, but the story will be depicted not with his face, just his words, images, and And with that, we'll begin to start to open up community conversations around issues of gender in a way that I think even before we came, people were saying, you're never going to be able to have that conversation with people, right? They're like, no, you just can't do that. And so we're already finding that through storytelling. It's not a survey question, it is their lived reality. We're able to start to broach these deeper topics. But it doesn't stay local. That's the beauty of this moment in time, is that I can send that story to you. I can send it to anyone in this room, right? This idea of being able to scale these stories and think about their impact. That's the moment.
I have a million questions, but I'm going to suppress my impulse to ask them because I'd like to hear some questions from the audience. So if you'd like to ask a question, just raise your hand and I'll call on you. Over here on the right. Please wait for the microphone.
Oh, great.
Thanks.
You know, I just loved your example at the very beginning where if something's complex, there are multiple levers to pull, seeing it as an opportunity rather than a challenge. So I have a friend that likes to say that the greatest invention in the 19th and 20th century was scientific method, and the most limiting factor in the 21st century is scientific method. That things are just irreducibly complex. So you work at the University of Chicago, which I think of as the high cathedral of randomized controlled trials, and yet, and yet
right.
you've got a very kind of nimble, intellectually curious mind, and are doing some, just really fascinating cross-fertilization across topics and so on. So I just wonder, looking at these problems in an environment where everybody's always looking for the single causal element, but you seem to be more focused on what works and aren't so limited by barrier. Could you just talk about that tension?
Yeah, that's a great question, and it is my. You can just be my therapist, right? It's just my lived reality. You nailed it. So it's a very interesting. So I come out of the biomedical tradition. So my very first study was a behavioral trial where I worked with adolescent mothers. I was a resident at Northwestern at the time, and we were right under the shadow of Cabrini Green, and so I created a study to help young mothers use birth control pills after delivery, and I created focus groups. We created videos. They created all the materials. They had more knowledge, they had more intentions, it was theory driven, it was randomized. Then reality smacked me in the face. It was chaos. They were getting kicked. I was following them longitudinally. They were getting kicked out of school. They were getting their lights turned off. They had unstable living situations. It did not matter that I had a randomized controlled trial that was really well designed. There was the reality of people's lives. And my trial was based on my thinking. Well, if you just take a pill a day, right, and I'm going to see you at your 6-week visit, and I'm going to give you that prescription. They don't even come to their 6-week visit. But we hadn't designed a system for these young people. So the key with randomized controlled trials is that they have what we call internal validity, right? They're really nicely designed, but they don't necessarily work for all populations. They don't work externally. And so my sort of thought about this is that we have to think more broadly about some of the other factors that might be influencing our outcome and not be so narrow to that we want a very clean study, that we don't think about all of these other things that might affect people. And this is really important because when we run clinical trials, we want clinical trials that have really good results because we eventually want to market our drug or whatever our product is, and so we don't want a lot of noise in the system. As a result, for example, if you think about the contraceptive implant, it was studied in women who were 130% of ideal body weight. We had no information about overweight women, despite the fact that most women are overweight, because it could have messed up our clinical trial. So we have to really be suspicious about getting overly caught up in randomized controlled trials if they're not really asking the questions that matter to our lived experience. What happens when the average woman takes this medication? It's great if Barbie takes it and that's what happens, but what happens when the average woman takes it? And if people, when they have all the money to do the trials, aren't asking those questions, they're not relevant. So how do you do this at the University of Chicago when people say, Yeah, but is that evidence? Where's your control group? So I will tell you, I'm not the most courageous person. I have kept my clinical trial and my biomedical program going, and I snuck over here and started designing games and telling stories with young people. And then all of a sudden I was like, you know what? That game stuff is working better than that biomedical stuff. And then I came out of the closet, so to speak, and everyone's like, this is great. So it's been a really funny place to see a place like the University of Chicago really embrace the game work, because it is different, and they can see that there are a lot of problems that we have been trying to solve. For example, how do we get young people to come to campus? How do we get them engaged in STEM? How do we get them engaged and excited about future careers in health? And suddenly the idea that not that you're going to come to University of Chicago and be drilled, but you're going to come to the University of Chicago and play has actually allowed us to really teach a ton of information about science and technology and engineering and all of these other topics. So I think it's almost that tension for us that is really fun, that tension between science and data that is really fun. Many times we do drift into the hard evidence, and we do put in control groups and really trying to show that these techniques stand up to the level of other types of randomization. For us, that's really exciting. But it's been a journey.
Right here in the center.
Thank you for your insight. I think it's very inspirational. As a college student that's interested in medicine, public health, and particularly health policy, I struggle with the following, and I'm hoping you can shed some light on this. As you stated, sustainable programming starts at the local level and kind of integrates that perspective. And those college students and young professionals that are interested in being an active part of health policy, what role do you see them playing? Those college students that are not directly affected by the problem, but also want to be a part of the health policy programming and designing that.
So that's a great question. So I'm going to first of all just start from a sort of a philosophical, and then it seems like kind of a trend. First I'll tell you my philosophy, then I'll tell you some facts. But so one of my profound beliefs is that each of us has power based on who we are, our potential, whatever it is, right? I mean, think about it. You're kind of like, I'm a college student and do I really have something to say on those issues? I'm an OBGYN and I'm like drifting into education, right? You know, I think, but you have power as a college student, right? Now, the question is, where do you best apply it? You know, it might be that what your role is advocating for the responsibility of your institution in your local community, right? So I believe in the power of young people. There are things that young people can say that will shame adults, that you can hold their feet to the fire in a way that people will not listen to a colleague. On the clinical ward, we want to look good for medical students, right? Parents want their kids to be proud of them, right? You have an incredible power just from your insights. And so really think about it and really use that. On the other hand, there's also a humility that I think I'm also hearing in your question, which is, I don't want to presume I know more than somebody else, or I'm at the beginning of my studies and I'm going to have to get a lot of information. But the power of ideas and the power of being able to say that what seems right, what seems fair, is really, really important. So again, to take an example from clinical medicine, it is absolutely proven that people have better outcomes in teaching hospitals than they do in non-teaching hospitals. What's the main difference? You are teaching. It means you have to have medical students, you have to have people who are questioning what you are doing, questioning the validity of what you're saying, questioning whether there's evidence or data. So even if you don't have an answer, you even have the ability to question. So I don't know exactly what the right role is for you, but the ability to question is incredibly important, and the ability to apply what you know and believe in is also incredibly important.
Hang on one second, we'll get you a microphone.
Have you used what you're doing to start similar programs, say, in suburban areas around Chicago? And what kinds of elements would you need to make it work? This is not South Chicago, but these are areas that have large immigrant populations, that have a lot of structural issues as well. And the community I'm in has a number of institutions that could really help a lot. A medical foundation, for example, a community medical foundation, an interest in STEM, a program, an arts program in the community center that could be utilized for similar kinds of storytelling or board games. I'd love to be able to take your ideas and test them out locally and just see if we can't make a difference too.
So that is such an important point. One of the things that helped bring the significance of that home to us is that we were Brandon, the executive director of our center, and I were meeting with a local community, a federally qualified health center, and they were describing how so many of their centers are actually not just on the south and west side of Chicago, they're in the suburbs as well. And so your point is incredibly well taken, that these are not relegated to just single neighborhoods. So we've been thinking a lot about how we take, universities are such rich places. The fact that we can even create a center the way that we do, it's because in a very few numbers of blocks, we have a brain trust. We have all of these faculty, all of these students, all of these staff members, all of our patients. We have it's just an incredible moment. And how do we, but we're actually paid. It's the public's money, right? Our funding comes from the National Institutes of Health and the National Science Foundation. Our tax dollars are paying for this knowledge. Why aren't we sharing it? So we started asking that question and taking it very, very seriously. And so one of the things that I have had to do is start to learn about scaling and learn about how we take things that are designed on a college campus and how do we start to disseminate it. So we're pretty early in this process, but one of the things that we very intentionally did was to design a video game that would be able to be played just by having the link and playing it and then creating a curriculum. And so I think one of the speakers said it earlier that you have to design with the idea of scaling. So our first projects were designed with the idea of engaging young people and having fun with them and learning from them. But our subsequent projects have really been designed with the idea of how are we going to next get this into the hands of other people. So right now we just finished last month a game on sexual violence. We use a bystander role where we're really talking about also the community's responsibility and the community's abilities to address some of the antecedents to sexual violence. But that, for example, is a game that we, once we create the randomized control trial, which we will, it will go into community settings. So your point is very well taken in that actually thinking about how to implement things more broadly is really important to us. One of the other we talked a little bit about the affordances of board games, but the affordances of video games is you don't need rules. As soon as you go on, you just kind of play and work your way through it and figure it out. And so we think that'll be a particularly good way to bring these ideas and these practices and these skills into other settings.
Well, I wish we had time for more questions, but let's thank our speaker, Melissa Gilliam.
Foundation. I'd like to welcome you to this program. The recently created Sustainable Development Goals frame the global community's effort to secure a safe and healthy future. A critical part of many of the goals is the health and well-being of women and girls. Today's panel is an important one. It was developed to take a nuanced look at why we, as a global community, have not yet solved many of the solvable challenges that we hear about on a regular basis. It is sometimes helpful to take a step back and explore if we are asking the right questions and if we're using the right information to make informed policies. From girls regularly receiving less support than boys, to continued sexual violence at home and in crisis zones. Today's panel will take a look at how far we still have to go, but also why there is hope for the future. You have a full copy of the speakers' bios in your brochure, but let me briefly tell you a little bit about their achievements. Lori DiPrete Brown is the director of the Women and Wellbeing Initiative at the University of Wisconsin-Madison. She has worked with USAID, the World Health Organization, CARE, and Save the Children. Her novel, Caminata, is based on her Peace Corps service in Honduras. Our moderator is the executive director of GlobeMed, Alyssa Smaldino. Alyssa has worked on expanding GlobeMed's long-term partnerships between university students and grassroots organizations in 18 countries around the world. She holds a BS in Public Health from the George Washington University. On a closing note, you will notice that Evelyn Diaz was not able to join us this morning. She is ill and had to cancel at the last minute. After the discussion, Sebastian Burka, Director of the Corporate Programs at the Chicago Council on Global Affairs, will be taking the stage to moderate the Q&A. Thank you so much, and thank you for coming to the panel.
Thank you. Good morning, everybody. Thank you so much for being here, and thank you to the Council for inviting me to be a part of the program today. I'm going to start by framing for us why this issue is important to talk about and what some bigger players within the UN have said about the topic of girls' health in the past year in particular. So by show of hands, how many people know what the Sustainable Development Goals are? Okay, so probably the majority, but for those who don't know, the Sustainable Development Goals follow the Millennium Development Goals, which were the UN's goals for development between 2000 and 2015. So on September 25th of this past year, 2015, all member countries of the United Nations came together in New York to establish a new set of priorities for the field of global health and development over the next 15 years. And the goals themselves are not legally binding goals, but they are expected to be implemented at the country level and also monitored and reviewed at the country level. But for us as a global health community, they inform our priorities and we must work together to achieve them. The fifth goal is achieve gender equality and empower all women and girls. And this is the goal that our panel will focus on today. There are a number of targets within that goal. There are 17 goals total and over 100 targets total. And there's a number of targets within the gender equality goal. And many of them focus on the topics that you've already heard about today, such as eliminating all forms of discrimination, violence, and harmful practices against women and girls. But they also seek to ensure the full and effective participation of women in leadership and decision-making roles, and full access, global access to reproductive care and reproductive rights. And so I encourage you to learn more about the Sustainable Development Goals at un.org/sustainable development. But I'm going to pass it to Lori to share a bit about how the work that she's doing at UW-Madison in Wisconsin is helping to further this particular Sustainable Development Goal.
Thanks, Alyssa. I'd like to thank the council, particularly my friend and long-term colleague, Julie Stagliano, who is engaged with the council, and it's an honor to share the stage with Alyssa, who represents GlobeMed, which is an organization that I just love. I'm going to do two things now. First, I'm going to tell you, I want to offer you some questions to carry through this presentation so that when you make your comments at the end, they can be enlightened by these questions. I think we want the agenda for girls and women to be more aspirational than it is. And I say this from a position of I've been involved in this work since 1983. I graduated from high school when Alma Ata was, Health for All by the year 2000. I had been in practice for a while in the year 2000 when we came up with the Millennium Development Goals. And we knew by 2015 we were going to do a lot of things. We did a lot of them. We failed to do a lot of them. And then the new agenda, the Sustainable Development Goals, says very clearly we're going to finish the MDG agenda and do these new aspirational things. So someone like me, I've been in the game a while, and I probably have a responsibility to be somewhat self-critical if I'm going to talk about this. So I do love my work. I am involved in programs for orphans and vulnerable children. I'm involved in stopping sex trafficking. I'm involved in stopping abuse for women. I'm involved in a feminine menstrual hygiene program in Ghana that is teaching women to have micro-enterprises to make sanitary pads so girls will stay in school. Wow, right? What could be better than that? A lot of things could be better than that. I love this agenda, and it makes me furious at the same time. That in 2015, we're doing this, that survivors have to spend the rest of their life helping others survive. Can't that be art critics or restaurant critics, even better, right? We have this work to do. We have to be water carriers for other women, and we want to. We do it with love. It's joyful. It's meaningful. But when are we going to be really building on the aspirational part of our agenda and not the healing? And when are we going to start really moving the frontier of what we assume is possible? So again, I was asked to enrage and engage you. I'm a hopeful person. I don't get people mad. But I hope sometimes we'll look at ourselves and say, why this? And the insight came from a colleague of mine who'd done a beautiful book. Her name is Lucy Steinitz. She did a beautiful book about child-headed households and how mostly young girls were raising their young siblings because they'd lost their parents due to HIV. And it was glossy, it was beautiful, it was like the apps we're talking about, meaningful. She did it, she loved it. And I said, wow, you must be so proud of this. And she said, yeah, I like it. I wish I didn't have to write a book like this. I wish I didn't have to make an app about how to defend yourself against domestic violence. So let's just remember to turn things upside down once in a while as we do this kind of healing work. And there's a couple of, I thought of 5 things this morning that can be tools for all of us to do that. And so I wanted you to use these kinds of questionings to think about your questions to us. And especially, be hard on me, I'll learn from you, because we're just starting with our university-based initiative that I'll be telling you about. But the first thing is, when you hear talk about women, listen for the words because versus and. Because when you hear that we want to help girls be healthy in order that their babies will be healthy, that's very instrumental language. And on some level, it's because girls being healthy in themselves isn't enough. We have to keep explaining, right? And so there's nothing wrong with saying and. I mean, women want their children to be healthy. When I talk to women who are really suffering, they're like, if my kids are okay, I'm fine with all that I've been through. So I'm not saying we don't want to have that double effect, but if it's why you do, and I come from Wisconsin, so I'm going to talk cows for a minute, right? We feed our cows really well so the milk will be better. And if our logic for our girls is the same as the logic for our dairy farms, we're not rights-based. We're not having the voices of women be central. It's a problem. So let's not use the instrumental language all the time. Sometimes we have to, and I've done that to get things passed, to get consensus, but make sure the rights-based language is there. So that's one. Because or and, listen for it. Another example, besides the cow, I have to throw it in, is the Zika, right? We're talking about, now we have to talk about family planning because Zika. Well, you know what? Over 4 million women in Latin America die every year because they don't have access to reproductive health, abortion when they need it, family planning to prevent it. That wasn't enough. It's because Zika. What does that tell you about how women's lives are implicitly valued? And it took about 25 days of social media for even this point that I've made to show up anywhere. It's not even in the mainstream of the conversation. So we have to be able to turn things upside down. When something's your culture, you can't see it. We forget there's air in the room. So how do we get to look at the air in the conversation about women? So those are my examples, because and. The second question is, what voices do you hear? So if you want to evaluate a program, like all the ones we're hearing about today, do you hear the voices of the people that you're in solidarity with in the story? Can you imagine their voices? If you can't even imagine their voices, they're pretty far downstream. Even if people from their countries have been involved, just because President Obama's at a table doesn't mean I love the guy, but doesn't mean my voice is at the table, or the kids that I want to advocate for. So we really have to think about what voices can you hear, a question to ask to help people grow their work is, what did those folks say? And so thinking about the voice of women is kind of central. A third thing is what's the language around what's happening? So girls are being trafficked. People are food insecure. It's very sanitized language. So when people are really hungry, they'll do a lot for food. There could be violence, there could be fighting, there's physical pain. Food insecure just doesn't really convey some of the other kinds of language about what it really means to suffer from hunger. So that's where this narrative thing that was talked about in the earlier session, if anybody happened to be in this room. Story's important because they tell the truth a little bit differently than technical language and numbers do. Together they work best. I'm an academic type, so I like numbers too. But so trafficked, what about that word? We're using it all the time. We're going to stop trafficking. Well, trafficking means that someone is forced to work without pay, often can't move around, may have food withheld from them. Probably, if they're lucky that their clients are using condoms, there's going to be 10 used condoms at the end of every day, because that's the rate that they're being forced to produce. So trafficking is a very sanitized word that keeps us from really looking at the horror of what people are living with. And I don't want to sensationalize and go into that. The labor trafficking can be just as bad as the sexual in some ways, but the reality of what it means to have those physical burdens, whether it's carrying, whether it's fishing, whether it's male, whether it's female, whether it's sex or other, is, or whether you're physically held in a room versus terrified that someone will go kill your mother if you don't do what you're told. All those things are what trafficking is. Trafficking sounds like a minor violation. I've had traffic tickets. Maybe you have. So anyway, think about language, where it places harm and how it characterizes suffering. It should be true, right? Then the fourth question is, how does the way we talk about the problem dole out stigma, shame, and power? If we are taking, if a solution is a supply side thing where we're, take, for example, obstetric care. What parts, what parts of that power belong in the hands of midwives versus, modern medicine in lower income settings, in rural settings? When we talk about orphans, it can be a very stigmatizing label in some settings. You don't need to, and sometimes people have mothers, but they use the term orphan for the child because they want to get benefits. So how would I feel if my kids were referred to as orphans at their school, right? So language matters. That's kind of number whatever we're on. And then the fifth thing is you need to listen to young leaders, which we'll do that today when we talk about GlobeMed. And I say this as someone who, I don't mean to patronize young people. Young leaders have wisdom that our whole generation, and I talk about 50-somethings when I say that, we have so much agency and ability to get stuff done. But if we don't work multi-generationally, and I mean across generations. Last night I was with a University of Wisconsin alum who's 93 years old, and when we were talking about what hope and what's possible, she said, look at Pearl Harbor. Our army wasn't even ready, and look what we did, And I think young people are talking about what's possible in the same way. So we really have to work across generations to combine the insight. They can see the air that we can't see. And, people in the later generations have a lot of ability to get things done. They can scale something up faster than someone who's just developing their career and their network. So listen to young people is my other one. So those are questions that can help us come up with a more aspirational agenda, critique our own work. And I use these, it's painful to me to critique what I've been doing for 30 years with these questions because I haven't been on the aspirational end as much as what I've liked to. So think about what you want for women and women's well-being and what we should be doing. And my question to myself and my work right now is looking at what should higher education be doing. And I'm going to say a few things about that and then turn it over to GlobeMed. I'm going to tell you about our UW-Madison 4W initiative. And the 4Ws are women and well-being in Wisconsin and the world. And I offer this as an example of something any school could do, and I hope any school will. And when we started this, people said, how do you know it's unique? And I said, well, do you ask the calculus professor if he's teaching something unique? Maybe we could just teach this at every school in the country and it would be okay. And that, but it turns out it is a bit unique because it's very interdisciplinary. We're working with the School of Human Ecology, which is where in land-grant universities women were traditionally educated, women's studies, and the Global Health Institute. But again, much of what we're doing can be done in other places. So when we say we want to make life better for women, we want to, what does that mean? Well, it does start by listening, and the kind of listening you've been hearing about in other sessions today. And last fall, I was in a rural village in Ghana working on one of our programs, and sitting in a circle with women talking about their lives. And we were asking them what they thought well-being meant to them. And when they described a good day, they said, there's enough water to bathe your children in the morning. There's enough food to give them a good breakfast and take them to school. And the harder days, the days that you're not feeling good, are, there's not enough food and we have trouble getting enough water and the fields are barren. And there are things we want to do about that. So we learned a lot from them, and we'll use those to develop educational materials and community practices that can be used by Peace Corps, by 4-H Ghana. We're doing a 4-H program in Ghana, and other organizations. And so for me, circles like these, they're really powerful. They have powerful ripple effects. And there's not a day or a moment when I don't have faith in that process. 1 and 1 is 2, and you just keep going. You get to high numbers very quickly. So you don't have to be afraid to do something small, especially if you have authenticity and scalability in mind, they'll just happen. So the neat thing about what we're doing is we're trying to say, okay, but we're an institution of higher ed. What should higher ed be doing? And we should be training leaders, and we can develop programs to do that, and students can do things about that, and you'll hear that from GlobeMed. And we have, and we should be addressing challenges. And so we have a couple of projects at UW. I'll give you an example briefly of those projects. One of them started in Ecuador, and we were with some students, some undergraduate students there, when Flora Yepes, a community health worker, asked me if we would help her women's circle. Another circle, huh? They call it Sumac Muyo, to start a small business. And they were making jewelry out of palm seeds, so really beautiful beads and environmentally sound. And we would help them. And of course, I'm a public health professional, so I had no business saying yes, and I said yes, which is a bad idea. But it worked out in this case because I went back to a university where we had design faculty and retailing faculty. And several years later, we now have this Wisconsin Without Borders marketplace. And the team has cultural knowledge from Latin American studies, design, and retailing, and they're working with artisan groups all over the world. The necklace that I'm wearing now was made in Mexico, and very unique product that is selling really well. So in the communities, the quality and the artistry and the revenues are up, and our students are learning. And we encourage them to have local. In fact, Rosa Sanchez, who helped with the Mexico partnership at the very beginning when we didn't even know if it would be successful, is here in the audience. She's a UW-Madison grad and works here in Chicago, so she can tell you more about this women's group than I can. And so now we're working in Ghana and Kenya, Nepal, India, as well as Mexico and Ecuador on projects like this. So you see, it grows. Little things get big. The second example that I'll give before I turn it over to the GlobeMed has to do with our sex trafficking, anti-sex trafficking initiative. And our issue was we really need this to be local to global because this is happening in Wisconsin. And we wanted students to learn and lead, and we wanted to make a difference. And we hosted an international policy forum on our UW campus. And we brought together researchers and leaders and survivors in one room from all over the world, Cambodia, Spain, Wisconsin, our native communities in our state as well. And listening to survivors about what they have been through and what they think care should look like. Everybody learned so much. There was a lot of hope in the room by the end. And some of the survivors commented it was the first time they'd felt really hopeful in a long time because this was a different kind of conversation than they had before. The other thing that I think will be of use for all of you, and I hope it'll be a benefit to you, we've established a UNESCO chair on gender and well-being and a culture of peace at UW-Madison. We heard about this award just a few weeks ago, and it means we really serve the region. We're the only gender and health UNESCO chair in the United States. So luckily it's in the Midwest, and so consider it your backyard, Chicago, or we're smaller, so we'll say that. But I hope that we'll be able to serve the region with this platform for a conversation. And we'll be, we have a conference coming up in April that I'll tell you, I'll have a flyer about back of the room rather than go into the details now. Or maybe I'll share that at the end. But anyway, just in closing, I think I've skirted around, some of the deeply troubling problems a little bit. But it's important to be hopeful, but also to realize that there's a lot of suffering here, discrimination that many of you might have experienced for different reasons, abject poverty, violence, the sexual exploitation. And when you stop and think about it, there's really nothing that can happen to a girl that you can imagine that isn't happening. It's a very, very grim reality. You cannot make anything up. The names have been changed, whatever. So how do we make sense of this and have this positive agenda with that happening? And I think we need to take our cues from women and girls themselves, like the ones I've been privileged to meet in my work, whether it's orphanages or rural villages or cities like this one, or schools or clinics. They're survivors of parental loss, human trafficking, migration, war. And there is a lot of sorrow and despair, but there's a lot of joy, song, there's hope, there's dreams. People are fighting for change. And so that reminds me, I better, get with the program if they feel hopeful. And we can't really ground our hopes in odds or projection models. Hope is a very gritty thing. It's not a Pollyanna thing. It's much harder to be hopeful and brutal about that and not giving up when things are really tough. And I think it's a moral imperative for us. And with that, I think, turning it over now is perfect, because a lot of my hope comes from working with young people and looking at the world through their lens and trying to be a mentor and partner and follower as appropriate. And so with that, we do a lot of curricular things for students, but what happens in their space, where there's student initiative, co-curricular, volunteerism, service, is really important. And that's, I think, where the GlobeMed is an excellent example of how that happens.
Thanks, Lori. So GlobeMed was founded at Northwestern 10 years ago this year. Actually, 10 years ago this month. We were founded by students who were frustrated. They saw a lot of short-term, unsustainable options for engaging in global health, but they found that many of these opportunities encouraged them to go abroad, establish a project, and then come home. And who knows what happens with the project. And so they created a model with the recognition that all over the world, there are people who are leading organizations and communities that are founded and led by the people in those communities. And so they created this model where one university works with one grassroots organization in a long-term partnership. And the role of the students is to advance the needs of the organization that have been identified by them and their communities. And so that was 10 years ago, like I mentioned. It started at 7 universities, and today we're at 56 universities working with 56 organizations all around the world. And I want to highlight just one of those partnerships today, which happens to be the partnership between GlobeMed at UW-Madison and their partner organization called Children of Peace Uganda. And I should just say that Lori is the faculty advisor for the chapter at GlobeMed at UW-Madison. So this is really, it's coincidence, but really perfect. And I think they probably could not have had these successes without her as well. So Children of Peace Uganda is the organization that GlobeMed at UW works with in Uganda. It was founded by a beautiful woman named Jane Akayu, who I wish was sitting here telling you about this. Jane grew up in Lira, Uganda, which is in northern Uganda, and really the epicenter in the heart of the war that happened in northern Uganda between 1986 and about 2008, although it never really formally ended, given that Joseph Kony, the leader of the Lord's Resistance Army, never actually attended the peace agreements in 2008. But that's a different story. The war was long and tragic, and women and girls in particular were deeply affected by the LRA, which is short for the Lord's Resistance Army. During the period of the war, approximately 15,000 girls were abducted. Many of them were raped and had children as a result of their rape. Joseph Kony himself is expected to have approximately 50 children with women he abducted, and you can only imagine the number of children that are living in northern Uganda who were born out of this crisis. Jane founded Children of Peace Uganda to support the women, who were then girls when they got raped during their abduction, and their children. She founded the organization because she started hearing stories of these children who are the children of the women who were abducted. And in the community, people have started talking, oh, those kids' dads killed my parents. Those kids' dads burned my home. That kid's dad is Joseph Kony. And there was no support system for these children to understand and process what was happening, and also for their mothers to understand and process what was happening as a result of their life. And so Jane founded this organization, and she's done incredible work. She's spoken in front of the UN. I strongly encourage you to Google the organization and her after this, because, like I said, she should be here speaking about it, not me. So last year, we got connected to Jane through a different organization and began a partnership between Children of Peace and GlobeMed at UW-Madison. And this is their first year in partnership. And so they've piloted a program that empowers 20 households that are led by women who were abducted by the LRA and who now have children who are affected by this crisis. And the role of the students is to fundraise for this project, to raise awareness about it on their campus, on social media, and in the broader community, and also to support Jane in any other ways that she needs within the organization. She's shared that the students have supported her through fundraising, through media, and also through research. And this year, what they're focusing on with these 20 households is providing economic viability for these homes. Many of the women and their children are stigmatized, and so opportunities for generating income are very limited. But beekeeping is something that is beginning to generate income in Uganda and can be sold both domestically and internationally. The honey that you get from the beekeeping. And so they've formed what's called a GSLA, or Group Savings and Loan Association, amongst these 20 women who lead these households. And together they're beekeeping, they're making money, and they're also saving and building community, which personally I think might be the most valuable part of a project like this. Because these women, since they've been stigmatized, have likely had very few opportunities and outlets to express the trauma that they've experienced and express the challenges of parenting in this environment. And so the group meets 2 times per month, and this summer the students from UW-Madison, between 2 and 5 students, will work on site to support this project, understand it, help the staff there evaluate it, and then set up their strategy for growing the project in the future. And this is how all of our partnerships work. And so I wanted to focus on this partnership not only because it's relevant, with Lori being my fellow panelists, but also because I think it highlights the complexities of the issue of girls' health. I can't even imagine what it must feel like to be these young women who are probably my age, but when I was 5, 10, I had a completely different life than they did, and you likely did as well. And so it's hard to understand and comprehend that, which is why I think we need to take Melissa Gilliam's advice from earlier and really see global health and public health as interconnected with social justice and take a systems lens on these issues, but also why we need to listen to communities, and particularly the organizations and communities that are founded and led by people from those communities who deeply understand the communities. And I mean, they are the community. So I think it's very, very important for us to think about how we vet, how we identify, vet, evaluate, and support these organizations in real ways. And through the GlobeMed partnerships, that's what we're trying to train students to do. And they're doing all of this year, supporting these 20 households to generate income, generate savings with just $6,000 of fundraising. And so you can imagine what the possibilities are, given that there are 15,000 girls and now women who were originally abducted. You can imagine the potential of learning from these 20 homes. And so I hope that sheds some light on the importance of thinking about global health on a systems level, the importance of investing in local communities, but also the importance of seeing the potential of young people and helping them apply their education in a really practical way through these types of relationships and experiences so that they can carry that forward into their careers.
Thank you very much. We have some time for questions. If you have a question, please raise your hand and I'll call on you. Wait for the microphone. My colleagues have microphones. So we have a question over there in the back.
I didn't practice this in my head, so I'm nervous about saying it right now. But in working with things with students, I guess what I find interesting is, like, how do you balance inspiring students to be interested in these global issues, because I know that is important for them to learn about things like that, but not exploiting the communities that you're working for, and also sending in people that really, like, they are in school, so they don't technically have any skills or many skills that can benefit those communities that aren't already there. So how do you balance that and make sure that you're actually serving that community more than you're, giving students a super fun weekend in Uganda?
I think there's a lot. Oh, do you want to go first? We'll both answer because we'll have different. There's a lot of layers to that. So initially, when I started this kind of service learning work, because I came to working with college students after 20 years of being development, I thought, kind of, what are you going to do with the kids along, kind of thing. And then I began to realize that when students are with you, it changes the relationship with the community, and there are some ways in which young people are ambassadors that you can't have that kind of equalizer effect as easily. And so in some ways it becomes it helps you break through. So in Ecuador, for example, I would tell the community the truth. My students are learning. They have a lot of skills. Actually, they do. They have a lot of skills, right? But they're learning. And would you be their teacher? And help us figure out some things they can do for you, and we'll figure out what some mutual benefits are. Well, being a teacher is a really honored thing, and they can really understand the respect that's conveyed when they're asked to participate with our students as a teacher. And I went along with that for a while, but I still did have the idea that is implicit in your question too, really, for many years, that we can't justify students going somewhere unless they somehow know more about something, right? Doesn't it have to be about technology transfer or knowledge transfer? Well, the whole assumption of that is based on this hierarchy where we only have a right to be somewhere if we're sort of better than other people in one way or another. And when I think about joining a book group or working to make change for a friend, it's really, I'm putting my hands in because I care. And obviously everybody's on a life course. People understand the life course, and age has a certain meaning. So for young people to be beginning and learning, as long as they're earnestly contributing, it kind of works. And I think consciousness is important. We also value labor. So we don't, sometimes students will go and quote unquote just work in a village. Well, in different cultures, I build a school, moving bricks, literally bags of, heavy stuff, right? I can't even, well, first of all, they figure out how hard physical labor is, which is not trivial for our students to learn. But the communities on the other side realize they were willing to come and lift sacks with us. They're just like us. It sometimes takes the sharing of menial tasks and sleeping in someone's community. It's not trivial to take students to live in a community or yourself to stay there, which is what I do. And communities will often say that the thing that was most valuable is that they were with them. So the idea of witness and accompaniment is a fairly sophisticated idea. There's a lot of abuses of all this. And I understand the problem of volunteerism and posting that kid you helped on the website. But that our students are trained about not using social media that way. And some of them do it anyway, and we make mistakes too. But all in all, it's way better than them wanting to go to the mall 5 times over spring break. And they build these commitments. They experience, love and solidarity. And I think solidarity, the meaning of it has evolved over time to being with people like you or connecting with the parts of people that are like you, to simply accompanying others on a journey that you don't fully understand with the knowledge that you're different. And it's not clear why we're together, but it's also not clear why we're apart, And so it's a messy answer, but I really think young people are amazing, and long trips aren't better than short trips unless you do better things. Otherwise, they're worse because you're doing the bad thing for a longer time, right? So the duration thing is important, but not always. I mean, many people can cite a conversation that they've had that was 5 minutes that changed their lives. Life-changing things can happen quickly. We don't know why. I remember one that happened to me because I'm blind in one of my eyes, and people thought maybe I couldn't, it was noticeable because I had a cataract. And so in school it was always commented on. And I remember this kid saying, "Mommy, this is that girl who's blind in one eye." And I don't remember her name. And I interacted with her for 5 seconds before I got on the bus. And she said, "Well, someday she may see more than we do." And I was like, oh. I'm going with that, And she kind of protected me from a lot of stigma I might have experienced. I was like, no, they just don't know I'm going to see more than them, as it went on. So there's a little example from my own life. So I think we can be more, again, aspirational about these things. We don't have to become cynical. Who does it serve if we become so cynical about students, right? It means they will, and the other side of this cynicism, and then I will turn it over, is the local question. So at Wisconsin, we don't think global work only happens. We have this weird idea that we're still on the planet when we're in Wisconsin, right? So you can actually take a global perspective on a local issue and be much more effective because you understand the context. So some of our students who do this field work, I went to Nepal, I had an amazing time. I learned so much, I loved the children. I went to Sierra Leone. I went to Sheboygan, which is one of our, nearby, and I had an amazing time. I grew up there. I never knew this, I never knew that. So making local spaces as interesting and exciting to engage in social change is something that we do with our global program. And bringing a global contest to local, it's not either or. Don't let them divide us that way.
Thank you for your question. This is basically the question that our organization was founded upon. So I have a 2-part answer that I'm going to ground in a story really briefly. So we were actually founded out of a different organization, and the mission of that organization was to send medical supplies to clinics abroad. And so a clinic had just been built by another organization that the students were working with here in the US. And the clinic that Northwestern students were shipping supplies to was in Ghana. And so they were shipping supplies. And so one summer, one of the students from Northwestern decided, I'm going to go to Ghana on my way home from visiting family in India and see what's going on with the clinic, take some pictures, it'll make it easier for us to do our work back home. And when he got there, he found an empty building with bags of medical supplies in it. And he recognized that there was actually a hospital right down the street that was a public hospital. And he asked, over time, he spent a little while there, and he eventually identified who was kind of like the well-respected community leader in this particular community, and asked him, why didn't you tell us that this wasn't what you wanted or needed? And he looked at him and said, Victor, we're African, we listen to our donors. And Victor was like, no, that's not how this should work. And he realized in that moment that this is not about access to things, this is about power and global power dynamics and the history and context behind them. And so he came back to the US. He brought together 40 students from 7 different universities in March of 2007, and they created this new model, recognizing that, like I said before, there are people within organizations, within communities that understand the community needs. But what's really real for them is that these power dynamics still exist, and they still dominate our global norms. And so through our training programs, we're training students to provide flexible funding. They can provide operational funding. They provide whatever the organization asks for, with some limitations because we can't have people on ARVs depending on student fundraising. So there are some limitations there, but for real reasons. But flexibility within partnerships and training about why that's important, and how to really engage in a way that the students are always trained to be learners and listeners and not leaders. Although we do say we're a leadership development organization, but trying to train for a new type of leadership. And you can see on our website 6 leadership practices that we use to inform these, all related to human skills that were co-developed with our partners. The second piece is that, so working in partnership with local people who understand their communities. And the second piece is the constant education, and I don't even want to call it education because our curriculum is not like typical education or typical curriculum. It's really grounded in small group conversations, activities, debates, and it focuses on things like structural racism. It focuses on things like structural adjustment and why global economics exist in the way that they do. Why does the developing world even exist? And so we help students think about these topics that maybe you don't get to really talk about in a real way in a classroom or even in a space like this typically. And we've tried to really infuse that commitment to anti-oppression across our organization. And so we recently, a few years back now, developed an anti-oppression statement that you can find on our website that focuses on the ways in which we address racism and other forms of discrimination within our organization, but also across our network, globally and domestically. And students are required to read that. They're required to participate in the weekly curricula. And you can't go abroad without doing all that, plus attending at least one in-person training with other students, et cetera. And so it's not, and then also I will just add, when students are on the ground, I think it's really important to think critically about who's informing their agenda and what is included in their agenda. The agenda of the students' work during their internships, which are between 1 and 2 months, are all developed by their partner organizations based on their actual needs that students can plug into. And we really encourage them to be not focused on project implementation at all, really, and rather on reflection of the partnership, where the gap's been, those dialogues that you have in workplaces, but you don't really know how to have in workplaces, and then also strategizing and strategic planning within the partnership. How can we be better partners to you?
Over here in the middle, please.
Hi, thank you both for your presentations so far and all of the wisdom you've shared. Given that the theme of this symposium is the health of the next generation, what are some of the concrete results and benefits that you've seen in terms of women and girls' health and their well-being?
Great. Well, so I'll speak to this topic a bit more broadly and maybe actually use a different partnership example, because this one I mentioned is in its pilot year, so that the results of their monitoring and evaluation haven't been identified yet. But personally, I was involved in GlobeMed at George Washington University, and our partnership was working with an organization in southern Rwanda, working with a cooperative of 50 women each year to actually do very similar work to what's happening in northern Uganda through this partnership I mentioned earlier, but really focused on community building. We had a 10-week curriculum that was led in collaboration between our local partner organization and nurses at a clinic. And then we also provided income generating opportunities through land rental and provision of goats for milk, also for fertilizer, and through agricultural supplies. And what we found there was really amazing. It was a fantastic partnership to be involved in, and probably the reason why I'm here. And what we found in that context was that in Rwanda, the government is very engaged in development. And so while at the beginning of the partnership in 2008, the government was not engaged yet, through the development of these cooperatives and the community building of the women who were all widows, it started working, and they started generating income. They started seeing results. The 50 women each year were identified by the nurses based on the 50 children at the clinic who were most malnourished, and these children mostly had kwashiorkor, which results in the lighter hair color and bloated bellies. And by the end of their first year, almost all, I can't remember the exact number, it was like somewhere in the 80% range of women found that their babies no longer had kwashiorkor because actually they attributed it mostly to the goat milk, which was interesting. And then they used most of the vegetables to sell for more income. And so over time, by 2012, the government had identified that this was really working, and they decided to invest in the local clinic where we had, where we were working with the nurses and collaborating with them. And they built a beautiful maternity ward for the entire region. And, it has OBGYNs now. It has local doctors and nurses providing quality reproductive care. And they also, working with the Ministry of Agriculture, the agricultural components became too complex for our partner organization to manage, and so they engaged the Ministry of Agriculture, who said, sure, we'll formally register these cooperatives, we'll provide them with additional training and support. And so now the partnership is fully transitioned to the government, and GlobeMed at George Washington University is working with a different organization. And so that's one example. It's hard to generalize with these things, but that's just an example that was from my personal experience. And then by the time I transitioned, I was working here full time. But
so let me share a little bit at the next level in terms of what evaluation and impact means and how we talk about it, because this is a tension that we face. It can look like we're not effective, right? And then why would people do more of this? And I think evaluation has to have the population-based indices. So for example, we really have, since I was born in 1961, we've made incredible progress on maternal mortality. Women do not die in childbirth globally at all like they used to. It's concentrated in a small number of countries. Most of those are war-torn countries where we know what to do in health if the larger issues are taken care of. Infant mortality, which is related to women's health, similar kinds of things where we've really reduced infant mortality and now have found some very, very particular things that can be done around birth and the neonatal experience called, if you Google the golden minute, you'll see a great video about what can happen in that first minute to drastically reduce with techniques like warming and making sure breathing's happening, basically kind of like a APGAR type process that can really make a difference. So there's just incredible hope here that the access to water, much better, still a challenge with sanitation. In terms of women in leadership, I think there's 46 countries where over 30% of women are leaders now. That wasn't the case. Wow, that to me, 46 countries is a small number. 30%, I mean, it's disappointing. But it's a huge amount of progress. Things are trending properly, And then in terms of reproductive health, there's about 220 million women in the world who want family planning, can't get it. I mean, that's a number that we can reach, and that also has decreased. So, and in education as well, there's still a gap, but it is smaller. The gap in the early childhood is pretty much closed, the primary, so now you're getting at other issues. So there's progress on all these fronts, and I think the idea that even government aid isn't effective or global assistance isn't effective, any kind of consulting work is effective sometimes and not. We've given incredible value as a global health sector, and we need to really boldly kind of own that, I think. And when we talk about possibility and what's possible with our students, I have a great, we talk about everything that's possible, get them really high, and then I show them this number, which is 66 billion. And that number is what it would cost every year to remove extreme poverty. And that's not all the poverty. Most poverty in the U.S. is not considered extreme poverty. In the Americas, really only Haiti and a few other places light up on that border. So there'd still be more to do. 66 billion. And people feel weighed down by the number. And even that number, 15,000, right? Sounds like a lot. Do you know how many students there are at UW? 20,000. That's like 1-to-1. It's only one school. I mean, this is a manageable number of children support. Well, that $66 billion number corresponds to what we spend on our pets in the United States every year. Your frontier about what's possible needs to shift, right? We don't doubt the guy or woman who says we can get a computer in every hand by the year, whatever. But to say we can make sure that there's no longer a food shortage. How many people believe that we can guarantee that there's no longer a food shortage? Okay, a few. For those of you who didn't raise your hand, do you know there's not even a food shortage right now? There's a food there will be a food shortage if we don't address it. But the food justice and the distributive justice around food is the bigger problem. Our food waste is about equal to the tonnage of food that's needed around the world. So, question authority here on what we think is possible. It's very important. The other number that I'll throw out, because I can't resist, and I use it with college students, and really all people need to think about it, but the amount that we spend in the U.S. on damages related to abuse of alcohol or substance abuse, $223 billion, because that includes hospital-type costs and expensive stuff, right? Well, that's 4 times what it would cost for us just to say we're going to do a little better in this area, and we'll use the money we save to, you can't move money around like that, unfortunately. So I'm playing with you a little bit too. But the harder thing is not do we have enough resources. It's really the knowing how, the digging down, the doing this place-based partnered work so carefully and just believing in, that it'll work out over time. And I think sometimes our models for progress or for success are very much based on a manufacturing metaphor where if I can do 50 a day, to do 500 I need 10. And I need, but that math is very limiting when we think of organic metaphors of what can grow if they're allowed to grow wild, or what invasive weeds go, or mitosis, right? You get doubling every minute. So if I had $1, and that dollar and every dollar that doubled every minute, do you know how quickly I'd get to $1 million? 20 minutes. So doubling is a very powerful thing. And when you think about trying to double, it's just not that hard. So I think the metaphors that are governing our mind, again, they're like that air. We don't realize why we're being so constrained in our sense of what's possible. But we need to, use numeric, quantitative evaluation rigorously, and also stories to kind of get the balance and keep moving forward and have a sense of progress. I do think there's been progress. I wish it was more, but I also, again, I love it and I'm furious about it at the same time.
Thank you. Unfortunately, that's all the time we have, so please join me in thanking our speakers.